You're watching News Desk with me, Anas Minu. Right now, we're taking you to the Information Ministry, where there's a news briefing by the Information Minister and his team. We expect the Ghana Health Service to give us an update on cases so far of COVID-19. We also expect some update on social support for the poor and vulnerable. And then the water relief system that was announced by the President, as well as the transport sector and some tax holidays. Let's go live to the Information Ministry.
As Honorable Vejibisa rightly said, a fund that His Excellency Nado said, and he set a good example as a leader, committing his 3 months to start as a seed capital. This is Eastern region. Together with our regional minister and others, we are coming up this morning to present a check of 100,000 to support this fund. We believe this one will go a long way to help us. God bless. Thank you.
Thank you very much. I'd ask you to hold on for me. I want to invite Wilma Africa. So please hold on for me. Let me invite Wilma Africa to quickly tell us yours as well. And then I would crave the indulgence of the Honorable Senior Minister who is here to receive these 2 contributions for us. Social distancing, please.
Okay, Honorable Minister, Honorable Ministers present, all protocols observed. I stand here representing Wilma Africa Limited, the manufacturers of your favorite Frytol brand and also importers of Fortune rice, and recently branched into the production of soap. First of all, we want to appreciate government under the leadership of His Excellency, the President, for the inspired leadership he has brought to bear on efforts to contain this pandemic that has plagued the world and that has also found its space in our country. We believe the inspired leadership has galvanized the country, and all efforts are now on deck. Everybody, all stakeholders are now involved in trying to deal with this situation. We commend our healthcare professionals, we commend the Minister of Education, all other stakeholders who are playing the active part in ensuring that we bring life to normalcy for life to continue. As a company that has woven itself into the fabric of this society, we felt we cannot also stand idle by. And so we are here to offer our widow's mite towards dealing with this pandemic. We have a total package of 1 million Ghana cedis, a cash donation of 100,000 Ghana cedi to go directly into the COVID fund that the government has set up. And then we also have, because we deal in food, and we reckon that there are vulnerable members in our society who have been impacted and which the government is making effort to support, we are making in total food items made up of rice, made up of oil, made up of soap, a value of 900,000 cedis. And so we will want to make this donation to government. We want to work with relevant government agencies that are directly involved in the distribution and make these products available so that we can reach out to vulnerable members of our society so they can sustain themselves until this pandemic is over. Thank you very much, Mr. Minister.
Thank you. Thank you very much, Wilma Africa. So MMDCs from the Eastern region, please step forward first. The Honorable Senior Minister will join us and will receive your donation. If you can please make way for him as he comes up the stairwell. And then after that, he will receive that for Wilma and then make some comments for us. You can shake hands.
Yes,
you can. So yes, that's a check from MMDCs from the Eastern region of the Republic. So we are very grateful to you for your contribution. Many thanks. Thank you, sir. So many thanks. Wilma Africa, please step forward with yours. Check. Wilma Africa, thank you. Thank you so much. We'll put it on. Honorable Senior Minister, a few comments, sir.
Colleague Minister for Health, Ministers, Honorable Kojo Opon Nkrumah. It is with great pleasure that I receive on behalf of government and for the account of COVID-19 a check of 100,000 cedis from the Eastern Region MMDCs and related officials. We are most grateful for this kind of gesture from administrators of the government. It's taking direct example from the president's own gesture. We would say big thank you to the MDCs of the Eastern Region and the regional minister and all those who have contributed to this handsome amount of 100,000 cedis. To the Wilma Africa Limited, their combination of the gifts is quite interesting. A cash donation of 100,000 and assorted food items. One of the challenges of us during the lockdown is feeding those who are very vulnerable. It is a big challenge, and as the government suggested, we intend to feed about 400,000 minimum people in the lockdown areas. And therefore, gifts of this type is very useful, and will continue to appeal to others to emulate the example of Wilma. Thank you very much for this kind gesture, and thank you for all those who have seen the need to come and support the government and, by extension, the COVID-19 Trust Fund to cater for those who have been disadvantaged by COVID-19. Thank you very much.
Thank you very much, Honorable Senior Minister. We are most grateful that you have received these ones for us. There are a few more donations, and I'll bring them in as we go along. But very quickly, let me start off by outlining the broad response program of government. Before that, for the benefit of our colleagues who are also transmitting in Chi, Anope Fiasieno, Enuma Kua Hudo Minu, and I say Kua Hudo Minu, Abekai Hon, Abeboa, their Abino Mampeni Eye, Edikai Eye, Abai Nkratche for a war, a Puemantem, Eastern Regional MMDCs, Omode, Omankason Botum Sika, 100,000 Ghana cedis, Titisika Nobe 1 billion. Edi ababe boa ejumo mampani ni aban no yebo mabaso senior minister Ajiamaye ansana Wilma Africa Ghana Limited omo ne produce fried toro ene emo ahodo ne nkeka ho omo so omo de sika 100,000 Ghana cedis tetisika no 1 billion ababe cheraban se omo de to foto nim na yede ayadwuma no ansana omo de nuane ahodo 900,000 Ghana cedis tetisika no be 9 billion nti okabomu a 1 million Ghana cedis, sikafu from 1 million Ghana cedis. And omo de abani na senior minister edi abanim ama yasom a sabri yede ka nia yede eye ejuma ahodo ni nyina yeda omo ase. Ebi mo so ho ADB is here, CCT group is here. We'll deal with those ones very shortly. But first, let me outline the broad strokes of the government response program. The COVID-19 pandemic, as it has hit Ghana, or even before it hit Ghana, caused the government of Ghana to come up with a response program, which is in 5 parts. The first part of the program is to limit and stop the importation of cases into Ghana. And that is a security operation led principally by the Ghana Immigration Service. And so you saw us issue travel advisories initially, and then close the borders subsequently, mandatorily quarantine persons who were coming in with the view of limiting and stopping the importation of cases. The second part of the strategy has got to deal with detection, containment of cases, and slowing down potential community spread. That is a health and security operation led jointly by the National Security Secretariat that has been coordinating what some will call the lockdown, or what we call the imposition of restrictions. The other part of it that deals with the enhanced tracing and testing program. And these two come together to help us detect, contain, and slow down community spread. The third part of the program is the care for the sick, that for those who have been identified as positive cases, how do we have a unique case management approach that ensures that A, we are able to give them adequate health care, B, we don't overcrowd our health facilities, C, we have enough logistics out there for healthcare persons and even for persons that may require intensive care. It's a health operation that is led by the minister responsible for health, working through the Ghana Health Service and then the teaching hospitals. And they've been administering that and giving us an update every time they join us. There's also a part of the strategy that deals with minimizing the impact on social and economic life. Minimizing the impact on social and economic life. It's a combination of finance-related measures led by the economic management team, supported by the minister responsible for finance, to ensure that monies that are required to help us limit the impact on the social lives of people and on the broader economy are made available. And then also supported by the minister responsible for social protection and gender, who is also ensuring that some 400,000 persons across Greater Accra and Greater Kumasi areas are supported, even at this time when there are restrictions. The final part of the strategy, the part 5, is about boosting domestic capacity and self-reliance at this point in time, using it as an opportunity to boost domestic capacity and self-reliance, so that the things required for this fight that we can locally produce, we produce them locally. And you've heard the president speak about PPEs and sanitizers, etc., that can be produced locally. Broadly, this is the framework of the government response program to COVID-19. I want to jump and go to the health matters first. The minister responsible for health is here with us. He'll give us a quick status update of where we are as at now. We've been providing you with updates from 11 p.m. the first night when 2 cases were recorded till now, and we hope to do so until we're able to bring down our curve. Minister Ajimamenu, please join us with the health update. What is the breakdown of our status currently? There are also questions about some details of the president's support for health workers, and we ask you to take advantage to also speak to us. Please join us.
Thank you, Kojo. Senior Minister, colleague Minister for Sanitation, Ghana Health Service Directors, media, ladies and gentlemen. I'd like to be brief. As at 6 April, that is yesterday, 23:30 hours, a total of 287 cases with 5 deaths have been recorded. Regional distribution of the cases are as follows. Greater Accra. This region has the most cases, 258, followed by Ashanti, 18, Northern Region, 10, Upper West, 1, Eastern Region, 1, and Upper East Region, 1. A total of 172 cases were reported from the routine and enhanced surveillance activities, and those from travelers under mandatory quarantine in both Accra and Tamale are 115. 115. That is Accra and Tamale. Accra is 105 and Tamale is 10. The period of mandatory quarantine for travelers who arrived on the 21st and 22nd March has ended. In all, a total of 1,030 travelers were quarantined during the period. Out of these, 79 were positive during the initial testing, whilst 951 were negative. 26 among those that were initially negative were found to have converted to be positive at the exit screening, bringing to a total of 105, which constitutes 10.2% among the travelers that were quarantined. Ladies and gentlemen, I think this is all I can say now on the trend of the disease. But when I get opportunity, I'll continue to remind ourselves of the protocols of social distancing. Maintain a distance of 2 meters between yourselves and anyone coughing or sneezing. Wash hands frequently with soap and running water. Avoid unprotected contact with farm or wild animals. This is very critical, because since we started, all we are talking about is handshaking and social distancing. We don't hear people talking about our contact with wild animals. Don't let us make unprotected contacts with farm or wild animals. When coughing or sneezing, cover your mouth and nose with your elbow or disposable tissue. Throw away the tissue in the bin and wash hands right away with soap and water. Avoid touching your mouth, nose, and eyes to limit spread of infection. Thank you very much. Let me now move on to some of the mitigating measures the President announced for health workers. We have made available 15 Ayalolo buses now in Accra, and a number again in Kumasi. This operation started yesterday. The buses that we have designated to carry health workers have been labeled health staff in front of the windscreens and on the sides. These are strictly to be utilized by health workers. They have done routes that will touch in some of the hospitals and polyclinics in Accra from various parts of Accra. So the 15 buses between Accra and Tema are operating on our major roads, but they have asked them to be going close to clinics where these workers are to facilitate their movement. They are moving during times that they start work, that will give them room to start work when they close and when the afternoon shift comes, so that when you close even in the night, there will be buses running to carry you home. We've given ample fuel, and it looks like the operation went very well yesterday. This morning there were complaints of health workers, a lot of them trying to go on a bus that would break the social distancing rules. So I'll plead with health workers who are boarding the buses that if you realize that there are a lot more people in the bus and the driver asks you to stay and wait, please listen and wait and get on the next bus that comes. The President mentioned tax relief for all health workers, and we are working on modalities to grant this tax relief to all health workers, including those even in the private sector, so that if you capture you and your employer in the private sector gives us your tax returns, they will pick your TIN numbers and will work with it such that you'll also benefit so far as you are a health worker. The other area that we have mentioned, which has caused a little bit of misunderstanding on radio, this morning I listened to one or two contributors, is the allowance or bonus that to be paid to the health workers. Please let everybody stay calm. The President is not thinking of leaving anyone behind. All of us are health workers. All of us are health workers. But not all of us will do some work that will make us take advantage of the large bonus. As I stand here, the health workers, yourself, and our associations know that a number of us are on steady leave. A number of us, over 3,000 nurses and midwives, are on steady leave, approved officially. So prior to COVID-19, they were not going to work. As at now, they have not been deployed, so they are staying at home. Nurses who are in school have closed, and they have gone on holidays, sort of. Some are in the lockdown areas. We have sent message to them that all of you should stand by. Should we experience an upsurge and our numbers are running out, we will deploy the second group. So some of us are sitting at home. Notwithstanding this, there are two types of nurses in two schools in Korle Bu: the critical care nurses, School of Peri-Operatives, and the School for Critical Care. Even their final year students and those in national service have already been recalled, and they are sitting in Korle Bu to be deployed to the emergency centers. And some of them have been deployed to Ghana East. They are helping some of the isolation centers in Accra now. These are people the president is thinking about. All of us will get a tax exemption. But honestly, if you compare those who are standing by in the school waiting to be deployed to Ghana East, to University of Ghana Medical Center, and those of us who are sitting at home now, I wouldn't make a conclusion. All nurses who are doing what we call rotation, it's like national service, have been asked by their facilities to go home until there's the need to call them back. If after 2 months, these rotation nurses have not been called back, we haven't made a conclusion yet. We are still looking at modalities. Even in the civil service, the instruction from Public Services Commission and the head of civil service is that directors and staff who are not providing essential services in the ministries should be asked to go home so that we can create space for social distancing. And even in health, quite a number of our directors have been asked to stay away. If the president wants to appreciate those who fought the battle, those who are not providing essential services for 2 months, what happens to them? So let us address this issue very passionately, and let us look at what we are doing as health workers to support the nation. Let me move to logistics. The president is making all efforts to resource the ministry to ensure that we have adequate numbers of protective equipment. In his speech, he mentioned about taking opportunity of the crisis we are in to build local capacity to do some of these things at home. As I speak, the Minister for Trade has selected 5 big companies to sew 3.6 million face masks, these nose masks. They will start delivery by tomorrow. We'll take delivery of 150,000 each day, and within the next 7 days or so, the whole country will be flooded with these masks, especially for health workers. So those in the peribrals, those who are still complaining, we did not have adequate numbers from the beginning, but from the next few days, we will have ample for all health workers to be protected. Those in case management and critical care areas, some quantities are there that we are providing, but we cannot flood the whole country all of a sudden with all these equipment. So gradually, as we move forward, some of these funds will come to everybody. I will appeal to all health workers that we should all exercise some little bit restraint and continue to support the president and his fight for COVID-19 to avoid the spreading the disease to ourselves. We are working so hard that we don't get into situations where some other countries are. There is hope, and I believe if we continue to work the way we have worked over the last few weeks, this thing will be over. Like the president said, it will come to pass. Let me thank you so much for your time. I thank you.
Honorable, you are touching the podium. You have to sanitize your hands. Distinguished guests, ladies and gentlemen, so that's the quick health update. I want to just provide some little nuance to it as we go along. The case count, as has gone up, has two significant things in it, for which reason it has gone up. The minister mentioned one. I want to repeat for emphasis. The decision was to mandatorily quarantine the about 1,030 persons who were coming in within that 48-hour period before the closure of our borders. Now, the first test proved that about 79 of them were positive. But the experts advised that it will still be important to ensure that the remaining are kept in mandatory quarantine for a 14-day period and tested a second time, because it is possible that somebody may have been exposed early and wasn't manifesting the exposure in the samples that were taken. And for that reason, they were kept in mandatory quarantine. And when the second test were done, 26 of them now turned positive. So a good chunk of our case count increase, as you have noticed from the data, is coming from the second group of persons who tested positive during the second test. The other part of it is the enhanced tracing exercise that has started. As the president mentioned on Sunday night, as at that time, about 19,000 persons had been traced. Samples had been taken from about 15,000. And he mentioned that his decision by the end of this week will be heavily informed by the results of that 15,000. Now, please pay attention to this. So far, over 15,000 that have had their samples taken. Out of that, the brief I have this morning is that 7,461 have been tested as at now. And out of that, 14, that is 0.18%, have tested positive. Let me take that again. Out of the 15,000 samples that are being processed, 7,461 have been run so far, been tested so far. 14, that's 0.18%, have tested positive. Now, these are some of the reasons for which you are seeing the case count go up. And that's why we continue to encourage people that do not get alarmed when you see the raw case count numbers go up. It is because we are aggressively going out there now in search of the virus. We will find these numbers. The more numbers we find, the better we are disposed for the Ghana Health Service to provide them with care for the sick, which is pillar number 5, or which is pillar number 4, or is it 3 rather? Pillar number 3, care for the sick, pillar number 3 on our strategy. So to explain the numbers that have gone up, please don't be alarmed. It is because we are aggressively testing. We have to do a second test for those in mandatory quarantine. And then the enhanced surveillance that has started is what is bringing these numbers up. So just so that we are guided accordingly. The Honorable Senior Minister informs me that he would have to leave to chair another meeting. So if you see him taking leave of us, please understand. We will receive some more of the donations. Other ministers are here and they will receive them for us. The Honorable Minister for Health has also given us the other part of the health brief. I want to very quickly move to one other item after I have done a quick translation into Twi, and that's to do with water matters. The President gives some instructions on how water should be handled. The Minister responsible for sanitation and water resources will explain that to us shortly. Sani amedi kanchire mu no aban okon aye kono ya chemu enum edi kan ne se ye pese bo Ghana ho ban na yare ne bi amfi ba bi amman bi wura Ghana eno ye dwuma ye bambo for titiro immigration for na edi ani man na ye eno ne ma ye issue travel advisory say mankofo bi mba Ghana do ba bi kra ya to ye borders mu our mampenia sign 2 more weeks. And sana one more bano crampon, ye sign Emma or Mutana dema, ya test wom. A tosumienu, Ghana Health Service, any bambo for a year, Juma, baby, yari any bi will be ano, ye be na. Ebio so no yahwe say yare nentia te say ensikrum eno ye detection, containment and then slowing down community spread. And also oma ye ho adwuma ye bo ho dawuro etoso me ensa ye wono mo ebehu so omo wo bi no kwa be na ebefa so ahwe wo care for the sick. And Ghana Health Service omo ye adwuma ewo Ministry of Health ase omo no omo hwe aye eho adwuma no na minister bebo ho dawuro kakra ansa na senia ye kwatia yare ni nsunsuanso wo ye sika sem ne abrabọ titiri ye nuanom enni bi ededa abonten no so no ye be hu senia ye behwe no eno gender minister ne finance minister ehwe die nim die twato ye kwan a yankase betumi aboa ye ho na niema ye ye wa ha ye yie ye betumi de ahwe ye ho no yetumi ahwe ede ahwe ye ho domestic capacity and self-reliance and also trade minister ne EMT ehwe ede anim then na ya bode ro kakra bebia sabre ya yigina cases a ye wo ababedu ye beka no e wo twi mu sesi ama obi aso ate ase ba sabre de mpesa me minister for sanitation and water resources. Please join us with an update on the water situation after the podium is sanitized.
Me pacho. Thank you very much, Kojo, for the invitation. I'm here to let us all know the full import of the instructions in the broadcast. During the 5th broadcast of His Excellency the President to the nation on COVID-19, he reiterated that Ghana Water Company Limited should ensure the stable supply of water during this period that we are fighting this deadly disease. And he went on that there will be no disconnection of supply. Furthermore, government will absorb the water bills for all Ghanaians for the next 3 months, i.e. April, May, and June. Added to that, water tankers, both public ones and privately owned ones, are also going to be mobilized to ensure the water supply to all vulnerable communities. I must state here that this also includes the Ghana Water Sanitation Agency. All their systems also will provide water for free. Again, all community-based water systems are to serve water to the community residents for free. All water bills for the above months for all domestic customers and standpipe users will be absorbed by government. I'm stressing this so that there will be no confusion. Also, hospitals, clinics, and other health centers will enjoy priority supply of water as they have been doing. If there's anything, they will call Ghana Water Company to quickly mobilize tanker services to serve them. We are also going to install polytanks in urban areas as well as, if necessary, the rural areas to make sure water is easily accessible. There are areas that have pipelines but are suffering from lack of water. These areas are being listed for tanker services to serve them. And these tanker services are being deployed nationwide to supply water. Meanwhile, we plead with all of us to make sure that we do not tamper with the pipelines and infrastructure of both Ghana Water Company Limited and Community Water and Sanitation Agency, so that we will have constant supply of water. All leakages should be reported to the nearest Ghana Water Company Limited offices promptly for attention. If you also notice any burst of pipelines, please report promptly as well. We are all encouraged to use water judiciously. Mechanisms are being put in place as we enjoy from the benevolence of our leader to monitor the irresponsible use of water. There's some WhatsApp going on whereby you have a grown-up man lying in a bowl with tap running, and this is a bad example. I think we should avoid all such expensive jokes and make sure we do the right thing by following the full protocol of WHO. This water is being made free because the president knows the importance of water in these critical times. We need water to wash our hands, to cook our food, and also to wash our bodies, and to make sure we practice full personal hygiene. Ghana Company Limited Ghana Water Company Limited will be sending SMS messages with bills, but there will be at the bottom a message that this is for you to check how much water you are using and how much water they are supplying to you. The message also contains a message that government is fully paying for this bill. So it's just for your information. So all bills, SMS texts will come with such messages to re-emphasize the fact that government is taking care of the water bills for April, May, and June. And all issues connected with water supply should call the call center. We've put out all the numbers and will continue to put out the numbers as time goes on. There are several numbers, 1, 2, 3, 4, 5, 6. There are 6, but I'll give 3 and the rest will be posted later. 0, 5, 5, 5, 1, 2, 3, 3, 9, 3. 0, 5, 5, 5, 1, 5, 5, 5, 2, 4. And 0, 2, 0, 7, 3, 8, 5, 0, 8, 7. Other operationalization issues will be giving out as time goes on. Thank you. Me pamucho se minister be ma me kwan kakra. Pese me ka e wo twi mu kakra. De mbeka ye ne nyina ne se aban adwene ye ho ama president ahyehye se yensua a yebu o yemfie na ye de ye ho adwuma se ye wohoro ye nsa ye dware ye de bi no aduane adi na ye nom no ne nyina fa ho ka. Ghana nyina enye lockdown areas no nko a Ghana nyina etobia so wo stand pipe e na wote ho agigi ska jai sika ne je aban se eye free ye wo systems e wo ye rural areas and peri-urban areas no ye community water and sanitation agency dia eno ukobu nsu a eye free na nko mo gigi bibi kakra om de maintenance eno nso mo obi anya obi esika ye wo NGOs so omo asisi systems a omo so de ma Ghana for ya sre omo ye de letter so besa akope so ama omo se omo nso nsuo no omo ma no free na sa amre Ghana for hen ha omo aban da ye nyina ase ahohehia ibaye mo modern bo ene ositie ene nkambo mu a ye de ko sa kun ye nkoso sada me so me office wo ho obia wo issue bi no anya Ghana water kra me wo ho community water so sanitation agency omo so de omo numbers ebeto dwa medam ase na nyame mo ye nyina ho ban.
Honorable Minister, thank you for that update. There are a few questions or a few issues we need to clarify. I think even up until this point, then I'll take the ADB donation before we come to the budget and finance matters as I spoke about earlier. So for those who have arrears in water bills, what does it mean for them? There's been a lot of stories going around about the fact that if you have arrears, you won't enjoy. Is that true? Is that the position? I'll come to Honorable Minister to respond to that for me later. And then, for example, bills have a 1-month lag. So the fact that we are having April, May, June, does it mean that March bills will not be distributed to us, or what? When we see a March bill, what should we think? I think those are matters we have to clarify. And then, Honorable Minister for Health, I think the key interpretation, especially of the benefit to health workers, is something we need to clear up so that we are quite clear on that one. And then also, in terms of the regional breakdown of the cases that you gave us, if we use a regional breakdown, it will come up to, I think, 289. Am I correct? Can we see the numbers? If we use a regional breakdown, it will come up to 289, but your case count tells us 287. We'll need you to clarify that for us before we wrap up. And then I'll take questions on these briefs that we've had so far, so that the ministers responsible can take leave of us while we go to the others. So, Honorable Minister for Health, 287 or 289, and then also for the health workers, if you can explain that in the tree for us.
Thank you, Kwajo. I've just cross-checked on the regional distribution. The Greater Accra region is actually 256, not 258, as I read or announced earlier. The Greater Accra region has most cases of 256, 256, not 258, as I read earlier. I was for Mr. Moa, health workers, measures na mampanyini tu biano. Mepe se mechiri mu akutri mu kakra. Ne dikane ye transport buses a health workers no de beko adwuma assign de abafie. Enkran kwa ye de 15 buses na asikwan so a efrase eye adwuma amayen cry say Kumasi so regional minister ne meya no the number of buses MCB 12 esikwanso a beso be ye adwuma ye de bibia tare ho say health staff nipa oye apomdene asoye adwuma Ghana Health Service private for no nyina aka ho so ye adwuma o private hospital maternity home baby ye adwuma bia on shende setare mpona kita ID card o kire se we health staff wa esese ye mafro bas no bi enra eko ye kama ye de bi so ato tema krom nyina ya pekwa na ebemben hospitals no a kire ayalolofo no baby a ye polyclinics no ne hospitals no wo enti route no bi kra ho a eko gina hospital num pe ema ni pasi time nia ye de aye no so ye ne regional director no of Ghana Health Service ne ya route no de ama ayalolofo no afi time nia nurses no ne doctors de ko adwuma be normal shift ne buses no run ne se be ya obenya nipa na afa be kwanso enre ko ye kama kakra anope ntia manya ne se buses no bi o ho a social distance no nti yembese nipa bebre be fro enso na nurses no ebi no mefro aboso bebre mesre mo a buses no do so kakra se ba se dia ye de asizi kwanso no e ma mu gina ho chere na sebe e waste time a ye be hwe nia e betumi de abeka ho a e be boa enti ma ye mpre ho ye nyina ye nkobom preko engina bus no social distance no so ehia ye pa ye ma panyini kan biem ne ye tax relief no se to a abane tete ye nyina ye katua so kakra no health workers no de nyina abane e twemu kakra kosi se coronavirus no asem no ebekofom nti no ye nyina health workers no nyina ye adwuma private clinics no se nyamo capture mo nyina mo benya no free as well obia wo tin number ye de ye ne tax nti o hospital ho de tax returns no ba ye be capture na ye ho adwuma amounts wanya free tax no nyama panyin de to ye ne mbie me ye bonus kakra ye bitua ama frontline workers say no ama yi kakra aba anopa radio smith no na associations no binom mpanimfo enya entiase yi mese mo a mampanyini dwene health focus no nyinaa ho a na dwene ne sebe yenkonja obi achi nti ye de sa word no bam front line no ama entiase kakra bi asate yi ne tia enye adwuma kese yi papa nya mampanyini adwuma na dwene ne se obeyi bi afrim na sebe no kro bi so ho a esese yeka sesi amenum weka sei ye wo health workers no bi no ma by steady leave corona no mbae no nka be wo school corona mbae no ba makwane enso beni ba bi a sebe ye adwuma be wo fie ti se ko ba se ye mabonus bi a sa nipa no de ne ye ne be ebeka ye nya nsipo ye ne ayi adwumafo no mpanimfo ehia ye wi a these modalities be babontene ye nyina ye dwene ho how to support each other front line na mampanyini kan no obi aka ho ne ntia meka se obi aka ho no okọ chip compounder yare no bi betima pie akura bi ase chip compound staff na ohoro ne be start de nipa no aba soro anse no be do treatment center nti ono so be ye exposed nti uyi sa nipa no frima enye ye ye bu nkonta a checke niema ye beto protection e dia ma health workers no treatment center cleaners e wo hokra ye frebe support staff ye de be gina e ka ho nti doctor gina ho o ye adwuma cleaner ho o prapra obi o ho a o support so obi ti wheelchair ma obi piana ba uyi ne frima enye ye enti ye ka se obi aka ho bi ye se cases bi o ho a se bi obi anim se we nom group we de se bi aba ma adwuma sa ne ye pese ye kire ba ye ni mpanimfo e kasa ye conclude a ye de be ba betu bia sesi ye kasa yi ade no ba first ye nyina ye ho wo so enti no we were looking for more health workers say ko ba say ye de na ye kakra ate say krobinom so de na ye benya nurses no ne doctors na ye adwuma ma ye doctor Mika say when they said say beka say wa wadwuma nhia kese pa kotra fie no say yes civil service na adwuma bibre directors no ko sa nurses abe national service they can rotation nurses by passing so here we binuma be ni financial clearance be nyina betifie ba ne be wo adwuma binuma hospitals abe adwuma nyina ba ma be kufie because ye hwehwe se nipa na nye dodo na social distancing ye betumi dia ye adwuma you are close to all training institutions and so binum wakolebu an ye train be for critical care adia no bae no sankra na ba 80 of them ya freba frifie abegu kolebu ho sesei be classmates na baka no betifie ndi se ko ba se sebe mampanyini adoya asoye so no ma bonus kakra se ne be si ache nafa me ka se ye de be mpanimfo hia ye nyanka front line sem no nwiye but mampanyini onje bia wo enso ye kue na se ye hwese sebe nia esese ye de bi ema no no na ye tumi ayi na ye de ema no ya sebe mpreduasa ye tifie no ekobasa abane no yentimi ntua sika no nyina ma obi a sebe onye hwe ye be wie na economy ne so ayede agu nti ye balance na minim sebre pam nti ase ebe ye adwuma amasa de na aba front line no nkyese ye yibi afrim but we are capturing those sebe mpreduasa ye deploy be kese enti ye wie ho asema ebeba we are working on these things April ending na ebe start etua allowances no bi ama nipa no ba contact tracing no there are several groups then the security for na aka bom be the MC ya start create allowances no bi ama be adwuma na edren kakra the whole day onam saa hwehwe nipa ba bia owo ne ade oyesa na nwumre wokofi ne se bibi kakra bia ama abotum kra na waba bebu until we have started paying some allowances to groups na be you know ono ya yaka yenka ho but be nyina ye can front line workers everybody is involved into be enya butare we sort it out say be ya ye nyina be nya ho keka papa ye tumi dia ye adwuma no ama ye tumi apa miare no free ye manima kwadwo am se no en medam wase bebre
Minister, thank you for the translation to Bono.
Bono.
Yes. He's MP for Doma.
Yes, Central.
Yes. His translation is in Bono. Let me speak about languages. So here, predominantly, we are doing English and Chi, and for our presenters, they would also try and translate into their local languages. But working with the Ghana Bureau of Languages, or the Bureau of Ghana Languages, what we are doing is that after the briefing, it will be translated into a number of languages and played back on networks across the country. So please forgive us if we don't speak more than 2 or 3 languages here. We're translating into about the 6 or so major local languages, and then it will be played on platforms across the country. Minister also explained the numbers. Just to be clear, the case count is 287. Ahenu ene eduowotwe enson sampempenso ye hona yewo. Na enema mienu edi akotene wo mene se wonoma yema omotena adem mfi abrochiri ba yema omotena adem no yedi kan test ye no eduoson kono 79 ene test positive. Ene ye ka se Woma test negative cry was say more mutena dem na yesa test won biom san say bia na wanya bi nenda ne ho adi ampaniampa ye test ye no emu aduonu nsia 26 subsequently tested positive e kan ho bi na ye numbers no akosoro ansana se say ya to mpanimfo agu abonte omukọ ye test bebrebe no nipa be 19,000 na yetumi ehuom asat kwasiada na jo mampani kasa impem dunkuno emu 15,000 na mama samples impem dunum sa impem dunum no ye fiase de fa imfidie nim anopei de nya ne se emu impem nson ahanan ene aduasia baako 7,461 na omatumi attested out of 15,000 no no na 14 attested positive. That is about 0.18%. Or hanchichemu hwene echiripo baako had tested positive. Saa nneɛma mmienu wei na ɛka ho ma yɛ numbers na akwakodu to 87 a yɛka no. Yɛka no saa yɛnka sɛ sɛbi obi antenda sɛ o bibia kora ni hɔ dabi. Yɛka sɛ don't panic. We are not saying say just take everything for granted. But what we are saying is say anase de ayɛka ne sɛ yɛpɛ sɛ wote baby numbers no efi no ase. Now, so please don't confuse our message of don't panic to mean just be reckless or be careless. We are only putting the numbers in context for you to have a full understanding. Honorable Minister for Sanitation and Water. So how about people who have arrears? Does it mean that they don't benefit, or does it mean you are going to reconnect their tap so that they can benefit? Then there was another question.
Bills.
Private tankers, how do they fit into this? Honorable Minister.
There wasn't a private. Okay. Thank you, Minister, for information. The arrears will be kept as arrears, but those who owe will enjoy water for April, May, and June. So there shouldn't be any alarm. The arrears are on hold. Tanker drivers, I had a meeting with them yesterday. They are on board with us. Government will absorb all the expenses and make sure they work and supply the water. And landlords, it wasn't asked, but I know there are landlords who also charge tenants for water. Please, with all due respect, the water should be given to all tenants for free, because the landlords will not be paying water bills for April, May, and June. So please take note. Also, I want to appeal to all of us that this is not the time to wash our cars with hoses for 1 hour for each car, and also water our gardens. Very soon, by God's omnipotence, we'll have the rainy season. So please abide by these simple rules and regulations. And nobody, please, should tamper with the infrastructure of Ghana Water and Community Water and Sanitation Agency. Also, for those of us in the peri-urban and rural areas using tokens and prepaid meters, your water supply will be uninterrupted. So please take note. And I repeat again, NGOs supplying water, we have appealed to them. We are going to appeal to them in writing to make sure they also supply water for free. Near me ka kakra no, the matron ne say obi odeka no, saa ka no aban de ne nsa to so. Enti no, bosumi a yewo mu yi, ene de eba no, ene de ebeba no. April, May, June. Obe enjoy nsuo anaso obenya nsuo anom ayo bibia eka no aban e de ne nsa to so se entwen eno de na emai nti no entwen nya no nti na wonya nsuo nom president so obia ne ba bia nya nsuo nom e na bosome miensan mu bills aba no eno so ye de nsa to so ye mfa ma ankora bia na create confusion say omunkotua water bill the mpese bibia betwintwan saa ade fefa o mampanya ya ma ye nyina no mu eti no me Ghana water for akasa say saa bosome me ensa bill no anka beba April no mo mema abonten kora mmere ni twam a na omo atumi aye ho adwuma na me san kan say yenya bia yesisi adan a ye de amema ankora titimu no mo bia nyi entonsuo ana onye nsuo sika fisa aban ede ne nsa to nsuo nyina so ya aban dia aban ho ka nyina wafa etu ye dan wura na do dan ya mema han a en charge tenant na so obi oto dan mu nsuo sika e na me san ka biem se yenya ya san ye mfomfo abrofomfo ne mfrawa we fie no nya sa amri na ye betwe nsuo no e de agugu so enche nyame ada ro mansuo beto nsuo no ta o garden no be ye kama ene ye horo cars be enum we fie a ye so house mu a free no nsia dumienu na enwie no eno so ye hwe ne yie na ye nye no kakra de bucket bu nsuo na de ahoro kama ena community water and sanitation agency so wo systems ni be prepaid meter ena bi so use tokens putoka say kan tokens ay say nkaprema bi no omo nyina nsuo no e wo stamp pipes no omo be hwe so mbenya nsuo omo be nya nsuo no enso free intimidamase.
Distinguished guests, ladies and gentlemen, we're going to pause here, and if there are questions on water and health, we'll take them now so that the ministers responsible can take leave of us and attend to other business. Water in particular, because the team from Ghana Health Service is here, they can deal with the other health matters. So are there questions on water? Yes, sir. Please come forward. I'm taking only questions on water at this point in time.
As we've been watching our live broadcast of the Information Minister's briefing on COVID-19, we've heard from the Minister of Health, who's given us a breakdown of the figures so far, brought some clarity to the figures, and we've also heard from the Water Resource and Sanitation Minister, Cecilia Abnadapa, giving us some more details on the announcement made by the President on water relief. I have with me here my colleague Winston Churchill. I'm about to give us some, to do some analysis on this. I know that the water thing is of interest to you. Sure. You live in an area, you have some challenges with water. How does it come to the breakdown that the Minister has given?
Well, I mean, the breakdown is good. At least it brings a lot of clarity on all the misconceptions that we had earlier, because there was this whole confusion as to about whether those who owed Ghana Water Company would enjoy it or not. The minister has told all of us that the Ghana Water Company Limited would put on hold those bills, and so for all the debts that you owe, the Ghana Water Company Limited has been directed not to even give you the bill. But she's also indicated, because the Information Minister had raised that very important issue, because there's always a 1 month lag. So what happens? So she said, well, from the directive, hold on after you know, the 3 months period, then you could bring it. So what it means is that if you owe Ghana Water Company Limited, you still can enjoy. But there are a few challenges here and there, and she's talked about how the tanker drivers and those who distribute water in tankers have decided to actually distribute water to persons and then come back and collect their monies from the ministry. The question you might want to ask yourself is, how do we know, for instance, how much it's going to be costing? I'm sure all these things will be dealt with, and so they would know there will be a login system that would, for instance, know that this number of liters have been distributed, and so people can go. She also talks about
even for those who have water supply cut to their homes now, how soon are they going to have water flowing through their taps because of this announcement?
Exactly, and that's where she talks about the poly tanks to be installed in urban centers to ensure easy accessibility.
Yeah.
Again, the question you would want to ask is how. So she seems to have put in place a lot of measures. The tanker drivers, questions. The tanker drivers have decided, they are going to be distributing water that will be paid for by you and I. When I say by you and I, by government. So government is paying for all of that. But I'm sure the questions that might be asked will deal with some of these challenges, Ernest.
Definitely, and then we'll be asking all the questions. But let's go back to the Information Ministry. Our colleagues there are asking some of the questions, very crucial, and we'll get some more clarity on that. I see the Sanitation Minister speaking.
Latest BR for now. It's in the bills no bebani atras say aban afa ho ka na mo behu they will use Ghana Water Force behu na will use se me metiwe na me use water to the tune of 100 cedis na me koye 500 aden na was at least to me check ho na hu se de wo ye na em say mo Ghana nti we de be sra nkwankora bia mo ma yenye ne yie mfa nhye mampanyin adwempa or ewo ye hu animonyam. The disconnection enu ye issue a obu ho a wadi bone ena yakotwam bone ni bi ne san illegal connection obi ho a ye wo ba bi a ensuo no ebi a efie be nsia na eduni waye illegal connection I enjoy ensuo no free o mampan de o de abai ye tena se ne ahwe each case on its own merit. Oh, baby, I disconnect to a tank a bebre unsio, Samri. But you better each disconnection issue on its own merit. But Yashisha say, no mampania can into no beer was at to be an mono. My auntie, na yemre unsio. Na fair was say, you disconnected, connect here. Say, and also, ya home meeting, ya better wage man. And to say so, be a illegal connection. I won't yai. It's on mampania may ensue. Free.
Honorable Minister, we are grateful. Honorable Minister says that ideally you're supposed to be using about 120 liters a day per person. But we continue to appeal to people that under these circumstances, it doesn't mean you should just be, opening those taps or misusing water. For those who have already been disconnected, alternate means are being made for you to get water through the tanker systems, and then they can examine your disconnection or the basis of the examination or the basis of your disconnection on a case-to-case basis and deal with it. And for those who make a living by managing water stations, the agency that is responsible for that particular water system will pay you your allowance. So you no longer need to be taking that money so that you get an allowance from it. Honorable Minister, we are very grateful, and you may take leave of us. ADB Bank is here. They have a quick donation to make. The Managing Director, Doc, please join me. Introduce yourself properly and tell us how you intend to support us. And then when we are done, the Minister for Gender and Social Protection is here. She will explain to us how the care for the vulnerable and the homeless is being undertaken, and then we'll explain some financial matters, the various budgets that have been made available and where we are in the utilization of those budgets, and take your questions. Social distance.
Yeah. Thank you, Honorable Minister for Health, Honorable Minister for Information, and I've also seen Minister for Gender here. I'm also here with one of my directors, Mr. Abankoyebua, and my DMD is also here with me. We are observing social distancing. Just to remind the general public that ADB is part of the Ghana Bankers Association, and recently we together donated 10 million cedis towards this pandemic eradication. Aside that, ADB has decided, with the approval of the Board of Directors, to commit 1 million Ghana cedis towards the eradication and control of the pandemic. From the 1 million, we are allocating 200,000 Ghana cedis for the COVID-19 pandemic. And I'm happy to have the Honorable Minister with me. We can just give it now to the Honorable Minister. Sorry. Again, we are allocating the 800,000 Ghana cedis for purchase of PPE to be distributed to some institutions, including Noguchi Medical Research, identified regional hospitals, the security agencies, farmer-based organizations in the peri-urban and rural areas. In addition, and jointly together with Ghana Bankers Association, interest rates have been reduced. It has, I think the details in the papers today, as heralded by the President of the Ghana Bankers Association. At ADB, all our branches are adhering to health protocols and to ensure the full implementation of the social distancing policy. We first reduced our staff strength by 45%. As of today, based on the experience and research gathered around the decision, we've reduced our staff strength by 52%. This is based on level of activity that we have observed. Farmers and fishers are of great importance to us, and very soon, that is in a matter of about a week, we want to introduce a model financing program for the poultry value chain, and we will announce the details later. Thank you to you all, our customers, Ghanaians. Let us all support government in pursuing this agenda. And Honorable Minister for Information, we greatly appreciate your work. Thank you.
Thank you, Doc, for that contribution from the ADB Bank. Very quickly, CCT Ghana is here. You have a donation as well to make. Please join us. And then the Honorable Minister for Gender and Social Protection would outline to us how we're going about this distribution of food, etc., for the vulnerable. Now, there are questions, for example, about how did we come by the figure of 400,000? Did we just pluck it from the air, or there's some science behind the 400,000 number? Honorable Minister, while you are speaking, we would like you to speak to that. CCT, please join us.
Good morning to our honorable ministers, fellow donors, the press, ladies and gentlemen, CCT Group, the fisherman's friend. We are into importation and distribution of quality and affordable fishing gear. We are donating an amount of 50,000 Ghana cedis to the COVID-19 fund. And in addition, we are also donating 100 Veronica buckets and bowls to support our gallant fishermen. As mentioned, we deal with these fisher folks directly, and they are of great importance to us. So the total contribution becomes 60,000 Ghana cedis. We want to do this to support the fight against COVID-19. Thank you, and God bless us all.
CCT Ghana, we are very grateful for your contribution. Ladies and gentlemen, we have two final briefs and then we will wrap up. First is a finance-related brief. I just want to explain that, and then the Minister for Social Protection and Gender will join us. The Minister for Health is taking leave of
And you're watching our live coverage of the Information Minister's briefing. We'll go back quickly to that feed once we're able to rectify that. We saw a number of donations coming in, but also the Sanitation Minister clarifying some of the issues. And Winston, one of the issues that has been in contention for those living in communities where they buy water, especially from landlords and what have you, that has been an issue of great concern. The clarity that has come, is that enough?
Well, it should be enough. That's if the landlords would listen, and I'm sure they would listen, but also because people then know now that they're not supposed to be paying for water. And so if you live in an area where the landlord normally would say, this is your water bill, you've been told by the minister that you're not supposed to pay. I expect landlords to actually go according to this. The challenge, however, is for those who live in estates, for instance, where they have to pay every 6 months for water. What happens to them?
And especially for the old women, especially in some of our communities, who depend on proceeds from this water. What happens to them? We've got a message on that. Let's go back to the Information Ministry.
Government of Ghana. The 35 million is to be approved by the World Bank Board, hopefully today, so that disbursement can be done as well for the preparedness program. The second part of it is the coronavirus alleviation package or program, which is budgeted about $219 million CD equivalent. That is being taken from oil funds. You would recall that quite recently, Parliament approved a transfer of that amount of money into the contingency fund. The Constitution says that the committee responsible for financial measures in Parliament is a committee that is seized with the power to decide how that money, once it's in the contingency, should be used. So the minister responsible for finance is going to make an application, and the committee will consider it and represent to the whole or to Parliament to allow for that fund to be made available for the coronavirus alleviation program, and we expect that to be a smooth process. That is what is being used for the social interventions or so and related matters that have been outlined. The President spoke to it on Sunday night during his address. And then finally, there will be the need to reignite the entire Ghanaian economy when this battle is over. So a broad stimulus package is being put together for that purpose. Cabinet met yesterday in an emergency cabinet meeting. The President directed that a broader stimulus package be put together to reignite the Ghanaian economy by the time this battle is over. So you'll find that in the coronavirus alleviation program, there's some 600 million cedis that is supposed to be used as soft loans. Yes, that is there, but there will be the need to do a broader and more elaborate stimulus program, which is being worked upon and will be announced subsequently. That's a quick finance-related brief. Sikasema yede kusanto kwa yechemu mienu, yedi kan akade a yehia $100 million. And no manpenima finance minister edi kan eye ho hyehyeye sa $100 million no $65 million de yensa kan because na esike wo hodeda na enkedi ye bibi foforo but potoka sem yesi avai a yede ye we say 35 na account there bosia World Bank board be approve na yensa kan de aye adwuma ansa na de tosu mienu coronavirus alleviation package $219 million and also no parliament eyi se sika na fi ye fan go sika mu e de ato contingency fund mu into finance minister ebe ko parliament anim say afi ye man nsanka se sika no constitution say committee a ehwe sikasem so parliament and ehwe se sika no so sabre ti finance minister be apply to sa committee no through parliament na ninsaka se sika no dia enema hodo so e ansa na ewi a de be ye magana sikasem asan pagya mu biom no de friend stimulus package na nkasa no enra cabinet issue Emma Mampeni ama instructions say mpanifo ntena se no mo starting krucheni na ngu nkrata so na mrepamu no ye de atudwa. Now to the final brief. Care for the vulnerable and the homeless. Minister for Gender and Social Protection after the podium is sanitized.
Good morning. First, let me answer how we got the 400 figure. NADMO, that is a disaster management, gave us a figure of 8 million affected areas. Out of the 8 million, we divided and chose 5%, giving us the 400,000. How are we doing the distribution of food? In Greater Accra, we are doing 250,000. We selected the areas, electoral area by electoral area, and then it comes to the district or constituency. The MMDCs know where the vulnerable are in every area. And so out of that, we have a list of ghettos. We are looking at the young men. We are not only looking at the Kayi. The debate is like Kayi. It is not about Kayi, it's about the vulnerable in society, the physically challenged, the shoeshine boy who has come all the way from every part of the country to come and look for greener pasture, the Makola woman who sells cassava in the market to make money or sells shoes or belts or cutlery, and out of what she makes a day, she cooks for the family. Now she's not going to work, she's locked out. Who cooks for her? Who gives her the money? And so we are doing raw food. And government is dealing not only with the Ministry of Social Protection, but we are dealing with the faith-based churches. We've given rice, yam, rice, maize, tin tomato, oil, eggs to the faith-based churches. Why the churches? This money is government initiative, government's budget, not a political budget. So the sharing of food does not have any political color. Any vulnerable person qualifies. And so we have caterers who are cooking in every corner of this country where we have selected. The caterer cooks maximum 500. And then we have coordinators who go around to check and make sure that the food that they have cooked is 500. Then NADMO monitors the sharing of the food. Because of social distancing, we don't want a large number. So even when we cook 500, it is not one person who goes out to distribute. It is splitted so that a lot of people will not cluster around where the food is. We are doing the hospitals. We are doing the polyclinics. We are doing the mental home. We are doing for those on the street. Apart from those who are allotted where to send the food, we have people who take the food in a van round town so that when we see any mentally derailed person, we give that person food. What we are going to do from today is also that the kenke seller at Choco or Bukom will be asked to cook 500 bowls of kenke in her area. We give her 500 tins of sardine or mackerel. so that she can feed those around the vicinity because they know them best. But we have somebody in Nadumo would monitor and make sure that 500 is shared and that nobody comes for double, or she does not serve 300 and tell us that she's serving 500. We want to do it such that everybody would have something to eat. Now the ministry has been turned into a kitchen, which I'm also very appreciative, because they realize that their mother is there. So as I speak to you, you come there are a lot of people. We give them food to eat. We go around and make sure that everybody has something to eat. This morning I had a call that government is doing nothing, that the churches are sending food. It is government that has given the churches food to send around. That money is not for the president, it is for government. That is how he's serving it this way. We don't want it to have any political color. It is a national issue. Where you think food is not coming to, as a media, we are putting a hotline number, 0800 800 800. 0800 800 800. When you call that number, you let us know where people have clustered that there's no food, or an area where food had not got into. I believe that the first 2 days will not have it 100%, but at least we want everybody to get food. Yesterday, there was excess food. They brought it back to the ministry, but I believe the other people who did not have anything to eat, because maybe we did not capture them. So by this medium, we are saying that if you know anywhere that food did not get to, let us know. Apart from that, we are trying to see our budget. If the food is enough, because corporate bodies are cooking for us, individuals are cooking, which we appreciate. If we have an excess, we'll start doing breakfast. Like the cocoa seller at point A can sell cocoa, point B can sell cocoa, point C, so that they can also get money into their pockets. So that is how the distribution is going. Our concentration, I'm talking about the Kaye, because that has become the topic of the day. Yesterday, Sunday, we started talking to the Kaye sleeping on the streets, that we are getting a place for them to stay, because we don't want them to be on the streets, for them to go out hawking. We got a place at Medina. It is a home, somebody gave it to us, a private person, but because we're not using the place for some time, they had a few challenges. We were working on it, because I believe that growing up, my mother moved to North Kaneshie. We lived in a house, Dansoman building, with no wall. Whilst we were there, we were doing the plastering. When circumstances happen like that, we look for a place, a comfortable place. That house that they took them to was a walled place, only that they had not finished. We were doing certain fixtures. Yesterday evening, I had a call that the Kaye said they want to be out, because whilst on the streets, they can move around and have their own private life. And so in the evening, Ayalolo, 5 military buses took them to the shelter. There were 381. It's a 500-seater. So we knew that we could accommodate them and bring more. Yesterday evening, they moved out and they said they were not going to stay there because they thought we were going to give them money. That is why they sat in the bus and came there. We are not giving anybody money. We cannot share money. We can share food. Kayes are no exception. The shoe shine boy who came from Techiman, the woman who came from Dunkwa to come and look for greener pasture here, who is locked out, is also very important, like the Kaye. So we are giving the vulnerable people. The concentration is not only on the Kaye. And so no money is going anywhere. I want that to be clear, because the media is saying that the government promised to give them money. When I did my first briefing, I said we're considering certain things, so I didn't mention any amount of money. No money is going out. We are giving food. We are also giving yam and foodstuff to homes. Mothers with children who would love to cook their own meal than to get the cooked meal. We are also giving them yam, rice, beans, gari, oil, tomato, eggs, and all that, so that they can cook at home. So this is where we have got into, and I believe that by the close of today and tomorrow, we'll get exactly what we wanted to do. Thank you so much.
And so you had Cynthia Morrison. She's the Minister in charge of Children and Social Protection, giving us some more details on what government is doing for the poor and vulnerable. I must say there are lots of questions in my mind right now. She talked about the MMDC helping identify some of these areas. She didn't tell us exactly where. Yesterday she says there was so much food, there were leftovers that was brought back to the ministry. I'm sure people do not know how to get in touch with the team, for instance, so they can have these packs of food being distributed.
Exactly, Ernest, because the minister starts by talking about, in answering the question of how they came by the 400,000 people, she says, okay, so they contacted NADMO, and NADMO gave them 8 million persons as those within the affected areas. And out of that, they decided to go with 5%. She doesn't really tell us how they came by that 5%. Actually, she says we divided and chose 5%. 5%. And that's the point. You don't know how they came by the 5%. How do you divide and choose? How the division was done, and based on what parameters did they identify the 5%, that is 400,000 people, as the most vulnerable. Because if we were to do analysis and use the Ghana Living Standard Survey of 2017, that says the poor people in the country, you're looking at 23.4%. If you had to do 23.4% of this, you certainly wouldn't get the 400,000. You're looking at getting in excess of 2 million people. One would have thought that as a ministry that supervises the implementation of LEAP, they would have figures and would have ways of identifying people who truly need assistance, rather than resorting to the ordinary kinky seller to say if there are people within your area. You can cook for them. Let's go back to the Information Ministry. Hopefully the Gender Minister will provide some more details. It is time for questions, and we'll hopefully get the answers also from the Minister. So let's go back there.
4 very quick questions. The first one has to do with the number of cases we're seeing. They keep increasing. What are the projections when you speak to the researchers, the scientists? What exactly are they telling us? When are we looking forward to some sort of plateau so that the numbers can decline? At least in other jurisdictions, we see that there are some projections. Are there any projections for Ghana? That's question number 1. Number 2 has to do with those $12 million odd dollars that have been, set aside for rent for these isolation centers. How exactly did we arrive at this amount? Is that amount going to increase at any point? That's my second question. Today happens to be World Health Day.
$12 million US for what?
So the isolation centers, for isolation basically.
Yes.
So rent. But what we've been told,
isolation centers is not rent.
Okay, so basically whatever the quarantine process, all those we are quarantining and the isolation, the figure that I have got is that we're spending some $12 million. How did we come?
Where is this figure from?
Okay, so I got it from a source. I cannot mention.
I can't interrogate. Okay, so you go ahead. Go ahead.
You might as well then maybe let us know how much exactly we're spending on
that's a different question.
Fine.
That's a
so how much exactly are we spending? How did we come by?
So the question is, how much are we spending on what?
So those who are being quarantined, for example.
On quarantine facilities.
Exactly. Okay. Isolation. How are we catering for that? How much is involved? Today happens to be World Health Day. As we celebrate our nurses, midwives, doctors, other healthcare professionals, we also know that I heard the Honorable Health Minister speaking earlier about how some of them are cramped, even attempting to get to work in buses and all of that. How are we protecting them? In recent times, we heard the doctors, the healthcare professionals at Kolebu complaining, threatening that they would even not work. So how much more can we do, to cater for them? In terms of the PPEs, that's what I'm referring to.
Okay, so your question is, what more can we do to ensure that everybody gets a PPE?
Exactly.
Okay,
exactly.
right.
And finally, to the Honorable Minister for Gender, Children and Social Protection. Yesterday, my team went around Circle, the VIP area, and you were just talking of an overflow of food, that there was excess food. Those there, from what we noticed, some of them did not get food. Over the weekend, I went around the Osu area, Dankwa, moving to other places. There were people there, some of them mentally ill, others without food. So I think you should take stock of these and maybe make provisions for other areas. Thank you.
Okay, so this one is a suggestion that the food distribution should be equitable.
It should be equitable.
So that it's not excess.
That some
if I may, your point is that it should be equitable, so that there's not excess somewhere when people don't have some. Minister, I think that's a suggestion, so we can take that. Thank you very much.
Thank you.
For that one. And then the health team, please take note of that question. What more can be done to ensure that everybody gets a PPE? There's a question that I would take. How much are we spending on the quarantine? And then you ask about isolation. I'll explain the difference between the two. Yes, sir.
My name is Mark Byron. I work with UTV. For me, I want to find out, in all this vulnerable...
UTV?
Yes, helping. All right, let me speak to you. And persons who living with disability. Saying was a bit more furniture, say it's almost a name, okay. More than Suma. So how are we liaising with the disassemblies to ensure that say staff will Suma bit me up warm? Okay. My second question is about sooner I say free now. Institutions, commercial institutions, as well
yes, sir. Is this the final question? Okay, I have 3 more finals. Okay, so 1, 2, 3, and then we'll wrap up. Yeah.
Yeah, but that's it. But you FM Kweku Steven, me age more man FM. Masemi Sando call my Ghana Health Service. And Pesemi who did he kind. Few days ago, in Yantia, unless a phobia or collabo, almost almost strike. I know how far Kusisen. Yatosum, you know,
Moko strike. Omoka says, so Monsan can't PPs. And then you put it in context. Let's not.
And TPC who I don't know what's saying. And I feel Kolebu Honoma so Andra a report by JoyNews HSA Oko a year breast cancer unit onoma omo jejuma sisi ayekase because of coronavirus. TPC who say mpenifu omatiana somewhat is what then amoya fa ho. That's it.
There's a report that Kolebu breast cancer unit is not working because of fear. Is that true? And what has been done about that? Yes, sir.
Yeah, my name is Godfrey Tanam with Media General. The Ghana Health Service website has introduced further description of the country's case, and then using the bar position as indicator.
Using the what position?
The bar positions as indicator.
I can't seem to hear you well.
Yes, exactly.
The bar graph?
Yes.
Okay, okay.
So I want to find out how is government appreciating the fact that more young people than very elderly in their 60s are affected, and then what are the true numbers according to the age of people who have been tested positive. Okay. And then there's some video of some 9 Ghanaians who are saying that they are still workers and stranded in Niger. They are having difficulty time in to over there. And then they are ready to pay for whatever transport they're supposed to come in Ghana, and then they are ready to be self-quarantine or mandatory quarantine anytime. And I want to find out if you have any plans of...
I'll respond to that one.
Yes,
I'll respond to that one.
Yes, and Dr. Letitia, PIG of the Population Council, has proposed the use of schools' boarding facilities to house the homeless in the interim while schools are on break. And this, she says, that will help will help government or maybe the country properly feed them, have them bath and protect them properly. And I want to find out if you have that one too in your...
so the Population Council head is making a proposal to government?
Exactly.
Okay, I'll respond to that one as well. Yes, let's take this final too.
Thank you. My name is Fred Smith from JoyNews. I'd like to find out what the plan is to prevent the spread of the virus from the areas where we've already recorded into those areas where we don't have cases yet. Thank you.
So plan to prevent spread in hotspot areas. Dr. Abadi, if you please pay attention to this. Is there a plan to prevent spread in hotspot areas? Then I'll take the last 2.
All right, so my name is Della Michelle. We know the government has about 300 ventilators. So I want to find out from the Ghana Health Service how many cases are on the ventilators. And then with your response, my follow-up question will be that whether we have more or less, is it because we have fewer number of the people being young, or there's a good drug working, or we have a deterioration of patient that is absent?
Thank you. Thank you. Thank you.
My name is Kojo Ajman from CDTV. Honorable Information Minister,
have you gotten any letter from DWTV regarding military brutality of one of your journalists with Zuria FM in Kumasi?
No, I have not received.
It hasn't gotten to your attention.
No, I have not received any such letter.
Okay. All right. I also want to find out that I was happy when the health minister mentioned that some indigenous companies have been contracted to produce PPEs. Who are these companies, and at what capacity are they going to produce in terms of the number of PPEs that they are going to give us on a weekly or daily basis? Thank you.
Okay, so very quickly, let me deal with that one. We can get you a list of the companies and then the work orders that we have given to them so that they can follow up. Let me take the final questions on the platform and then we'll move to answer.
Mr. Minister, there's a question asking the role of the Vice President in all this. The role of the Vice President in all this.
Okay. Is that the only question?
Yes.
Okay, all right. So let me quickly take some of the questions and then I'll invite our colleagues from health to help us. Let me go over the questions. Do we have a projection of what our case count should be? And if we do we want to be putting it out by now? That's my sense of the first question, because in other jurisdictions, people are reading that they have projections that they expect to hit this number by that time.